Hello everyone, my name is Frances and I'm going to discuss about MRSA. I chose MRSA because I've worked and lived around people that had MRSA, and I'm interested in knowing more, learning more about this bacteria. So in abbreviation it's MRSA, but in full it's the methicillin resistant Staphylococcus aureus. This bacteria is found on the skin and in the nose of healthy people or of everybody. The pathogen responsible for MRSA is the Staphylococcus aureus. It is a type of bacteria. It is a gram-positive in shaped bacterium. It often grows in clusters and it can be seen under my microscope. It lives harmlessly on human skin, all in the nose. MRSA is resistant to many antibiotics, including the methicillin, penicillin, amoxicillin, and so many others. And for that reason, it makes the infection so difficult to treat. MRSA can spread easily. So in this slide, I I pasted pictorial pictures or pictures of visual aids to give you a clear view of how MRSA looks like under a microscope and on the skin. So in our first picture, it shows you the Staphylococcus aureus appearance on the anger plates. So once a culture is taken from the infected area, it's put on the plate to find out if the person is infected with MRSA. And MRSA, in my next picture, the middle picture, you can see it's a wound on somebody's skin or on a skin, but that is a very small wound on those that I've worked with. Uh, those that I've worked with, almost all their legs are kind of all eaten up with this bacteria. It's very stubborn, very stubborn. So that is a small wound on what I've worked with. In my third picture, it's those blue like berries. That is MRSA and a microscope. So I wanted to give you something visual for you to relate while during this discussion of MRSA. So how is MRSA transmitted? MRSA spreads through direct contact with infected skin, wounds, or contaminated objects. So when we say contaminated objects, we go more into shared materials like maybe towels, razors, bed sheets. So if somebody is infected with MRSA and you guys are using these towels, the bed sheets, you share the razors, chances are high for you to get contaminated or to catch the bacteria. So it is very advised not to share such personal belongings. MRSA is also found on the skin and in the nose of the healthy people. It can be transferred through cuts or abrasions on the skin. MRSA resists many antibiotics. It's a very stubborn bacteria. So what could be the signs, symptoms, or incubation period, morbidity and mortality rate of MRSA? So some of the signs may include the red bumps, pus or drainage, fever, fatigue, or warmth around the infected area. So once you see all these, maybe somebody has an open skin or has a wound, and you start noticing there is pus or drainage, I would advise you take a culture. It could be blood culture, a sample from that area to find out or to rule out that this person has MRSA. So what are the symptoms? So symptoms can be shortness of breath, low blood pressure, rapid heartbeat, confusion, fatigue, bone or joint pain, rapid heartbeat, all. So all these things, I'm saying them if somebody has an open skin, has a wound, and they complain of all these symptoms, I would advise you to take a culture to rule out MRSA. So the incubation period of MRSA varies. So if there has been an exposure, it can take to 1 to 10 days um, to see the exposure, to see that somebody has been exposed to MRSA. And to others, they can stay with MRSA. Other people can be carriers of MRSA for weeks and months with no symptoms. In fact, most of us that work in the health sector, it's said that we are carriers of MRSA. We live with MRSA. We have MRSA. Like, we cannot resist the MRSA infection. So what is the morbidity of MRSA? MRSA is a major cause of healthcare associated infections worldwide, and it's found out that hospitalized patients experience the highest morbidity or the highest risks of getting MRSA. And what could be the mortality rate? So the mortality rate, skin infection has low mortality rate. It ranges between 10 to 20%. But if it's severe, it can rise up to 40 to 50% of vulnerable patients. So what could be the lab tests? I listed about 5 lab tests. One could be the bacterial culture, where they'll take a sample from the infected wound to go and find out, to incubate the bacteria to see how it grows. 2, it could be the antibiotic susceptibility testing, where the culture confirms that there is MRSA. So, and this they'll test to see if the bacteria is resistant or is against the antibiotics. Number 3, we do have the polymerase chain reaction testing, and this is where a rapid molecular test is used to detect the MRSA DNA. And number 4, we do have the gram stain, and this is a preliminary test performed on clinical samples. And MRSA will appear as a gram-positive COSI in clusters, and it will quickly identify the staph locus infection. Lastly, we do a blood culture, and this is where the infection has become so severe. So they will take a blood culture, or they do a blood culture to detect that there is MRSA in the bloodstream. So what is the treatment of MRSA? So the treatment could be a mild skin and soft infection by doing the incision, drainage, wound cleaning, and during this process, good hygiene is very much advised. Antibiotics, if that fails, or number 2 would be the intravenous antibiotics. Those are the IVs. And number 3, we'll do a decolonization therapy, where the naproxen nasal ointment or the body washes will be brought on board to see that this MRSA is being treated. And I want you to note there is no vaccine for MRSA yet. What could be an interesting new data on MRSA? So researchers are developing a biomaterial scaffold that trains the immune system before surgery to reduce the risk of infection, including MRSA. So early findings show promises in preventing deep infection after the device has been implemented. So MRSA is so very much, it's a scary disease or bacteria, a skin infection, but it's very interesting to learn about it. Thank you so much for your time. And I appreciate your comments. Have a good one. Bye.